Hi, and thank you for joining us today for our 2015 orthopedic coding review. We are going to make this short and sweet. Volume-wise, there's not a lot of new codes or revised codes. There is a couple major changes that we want to bring your attention to, and the reason we say major is because they're the most commonly used orthopedic codes. And so we'll draw your attention to those, but for the most part we should be 15 to 20 minutes and we will be done. So if you would please mute your phones, save your questions until the recording is finished, we will go ahead and get started. All right, Candice.
Okay, let's go over our 2015 ortho coding update. First one is Evaluation and Management Services. We have a new code, code 99490. This is used as a remote code. It's considered as a telehealth service. Patient does not have to be present, and the only thing that we need to follow is it needs to follow in the guidelines for at least 20 minutes clinical staff directed by physician. Patient has to meet 2 or more chronic conditions, and those chronic conditions need to last at least 12 months or until the death of the patient. For this code, CMS added this code is because to reduce healthcare costs. And those healthcare costs is by less hospital stays, less nursing home visits, and less ER visits. Joint injections. Our codes 2060005 and 10 have been revised. It's been revised to with ultrasound guidance instead of without. And then our joint injections codes 206040611 is with. The other ones were without.
So knowing that most of you orthopedic practices provide these services on a very consistent basis, we just want to draw your attention to the fact that the joint injection that you used to use and bill with the ultrasound code is no longer applicable. You will not bill an injection and ultrasound on 2 separate line items with 2 separate CPT codes. It will now be one CPT code, and in the same sense that all of healthcare is going, you are going to get paid less. So here's what the reimbursement looks like as far as a local Medicare reimbursement for what used to be 2 CPT codes in 2014 is now 1 CPT code in 2015, representing both services, the injection and the ultrasound. And you can see it's a considerable decrease in the reimbursement. This is becoming consistent throughout any of the changes that the AMA and CMS make with CPT codes. As they bundle them, they reduce the value. So this is going to be a significant reduction in value for all of you orthopods that are out, that are providing the joint injections with ultrasonic guidance.
Our ablation code. Code 20982 has been revised and now includes imaging guidance. New code 20983 describes percutaneous cryosurgical ablation of the bone. A category 3 code was once used and now has been replaced with 20983.
The AMA will give a new procedure or a new code, a Category 3 code, which means it's temporary. And what the AMA is doing is gauging its use and making sure that it's a usable code and looking at frequency of use. So obviously this procedure has become common enough that the AMA this year is implementing a new CPT code that's a standard CPT code for use.
Fracture codes 21800 and 21810 have been deleted. It was felt that closed rib fractures should now be included with an evaluation management service code. With that being said, we have our three new fracture rib codes. And basically, the new rib fracture codes is for open treatment. So they've developed a new set of codes. These codes are listed as unilateral codes. If we need to report with a bilateral, we need to add modifier 50.
And depending on the insurance carrier, you'll also want to potentially up your unit value if it's done bilaterally to 2 units.
Codes 22510 and 22512 have been, they replace codes 22520 to 22522. New codes describe the same procedure as the deleted codes, but now include bone biopsy when performed, plus all imaging guidance is now included.
And with that, the inclusion of the imaging guidance into a single CPT code, again, what was billed in 2014 as 2 codes is now combined or bundled into a single code, and you can see the reduction in reimbursement is quite substantial as far as the overall reimbursement for 2014 versus 2015.
And once again, new codes 22513, 22514, 22515 now are listed as new codes and replace 22523, 24, and 25. These codes describe the same type of procedure as the deleted codes. However, it now includes imaging guidance.
And again, a reduction in value because they've bundled 2 codes into one and reduced the value or the reimbursement.
Our disc replacement codes. 22856 has been revised and changed to a single inner space only. New code 22858 is listed as an add-on code for each additional inner space. This code was once reported with a Category 3 code 0092T and now has been replaced with a new code 22858. New code 27279 is used for percutaneous or minimally invasive arthrodesis, which was used to report with a Category 3 code 0334T. And revised code 27280 now states for open joint. Injection code 27370 has been revised to add contrast. Also, we have a few rules that have been added to 27370. It states do not use in conjunction with 20610, 11, and 71. So now it is now included. Also for arthrodesis of knee or injection, other than contrast, see codes 20610 and 20611. In drainage of the knee, it says use 29871. Casting codes 29020, 29025, and 29715 has been deleted. The following turnbuckle jacket casting has been deleted. It's obsolete. It's no longer being used in 2015. Radiology codes 72291 and 72292 is an inclusive component to our codes that we recently visited, 22510, 11, 13, 14, and 15. It's all included in those set of codes.
So these radiology codes that you used to bill separately have actually been deleted now, and they bundled them into the new vertebroplasty CPT codes.
Modifier 59 has been revised to add 4 new modifiers, which are HCPCS modifiers, known as XEPSU modifiers. So CMS established 4 new modifiers. They define the use of modifier 59, which is used to designate a distinct procedure service. CMS not replaced modifier 59, but has added these modifiers. It's to basically separate modifier 59 from it being abused, as CMS states that providers use it as an abused modifier, and also providers use it to bypass NCCI edits. So our 4 new modifiers are XE, separate encounter, XF, separate structure, XP, separate practitioner, XU, unusual non-overlapping service.
So, if you are a NewportMed client, this is extremely important no matter who does your billing or coding. But it's also important for you as a dictating physician on your operative reports. If we are doing your coding, we will assign the most specific modifier possible of the 4. But what we want to draw your attention to is the wording used in each of these. So we're hoping that you will include some sort of wording that will draw us to the specific modifier. We used to be able to just figure out what modifier applies, which was the single modifier 59, or at times it was the 51 modifier. We would review the carrier specifics and find out which modifier was best used. In this case, what used to be 1 modifier is now 4, so we'll need a little bit more specific documentation as you're describing your different procedures. If you can include some wording that will draw our attention to the reason the procedures are separate from one another, then we can dial it in to use the most specific X modifier. All right, that's the end of the presentation. The 3 big takeaways, if we can leave you with 3, are the joint injection codes, which will also, if you're using a fee ticket, will need to include the revision of your fee ticket to differentiate between just what is simply a joint injection or what is a joint injection performed with ultrasonic guidance. So you'll need to have those new CPT codes on your fee ticket, and then the 59 modifier is the other big takeaway. It will be very important to include wording to further specify in your operative reports the distinct nature of each different procedure. That will help us code it accurately and will help your claims get paid more promptly. So if you have any questions, feel free to contact Candice and I. If you will be attending the California Orthopedic Association's annual conference in Indian Wells this year, we will look forward to seeing you there.